I hate when this happens. I really hate when this happens. You're probably wondering, what's he talking about? Recently, a patient that I haven't seen for a while returned, and she was complaining of sharp pains in her low back, right down at the very low back. It hurts when she goes from a sitting to a standing. It hurts when she's sitting. And I said, well, I haven't seen you for a while. What have you been doing? I've been in PT for 6 weeks. And I said, how's that going? And she goes, I don't feel any better. I don't feel any better at all. And I said, what do they do for you? When I get there, they put me on the stationary bike for 15 minutes. And then they have me do some stretches. They have me do some core exercises. After that, they may do some electrical muscle stimulation. And she goes, I'm there for about an hour and 15 minutes. And I've been doing this again for 6 weeks, 3 times a week, and I'm not any better. And I looked at her and said, is this the same symptoms that you presented with me when we first met about 3 years ago? And she said, yeah. So let me give you a little background story. She came to my office 3 years ago with the exact same type of presentation. And I told her, I said, you've got a disc that is angry. It may not be herniated, but it is angry. And I showed her the diagram of what a disc looks like. I showed her what happens when a disc starts to get little tears or what we call fissures in it, and how it can release a chemical substance that comes out and irritates all the structures around there, including the nerve roots. And that if we don't take and get the pressure off the disc, if we don't get the joints moving, then she's going to go into a chronic pain syndrome. And it's not going to be so much of a structural issue at that time, but it's going to be more of a brain issue or what we call centralization. Now, don't misinterpret me here. I'm not saying it's all in her head. I'm saying that after a while, after the normal healing time has come and gone for injuries, if there still is pain, then it's gone from a structural or mechanical to a neurological, specifically to the brain, not receiving information from sensory receptors in the body, and the brain goes into protective mode. She was bent over, walking in what we call an antalgic lean, and she was guarding every one of her movements. Muscle spasms in the lower back, having trouble sleeping, and she was stressed, very stressed, because she's a nurse, a traveling nurse, and she didn't know if she was going to be able to continue on with her profession. So the first thing we did is we got her on our BioWave stimulation, which is like my pain stimulation, pain management. And we had her pain reduced by 50% in about 4 visits. And she was thrilled. Now, I was doing that also with chiropractic manipulation, specifically Cox flexion distraction technique. And it's a very gentle technique. It's not a rack 'em and crack 'em. We got the off the disc, we got the joints moving, and we got the pain signals blocked with the BioWave. Now it was time to move into the second phase, and that was using neurological stimulation to build up the muscles. And here's a quiz. If you can answer this quiz question, you send me a comment with the answer to this. If the answer is correct, I will send you a free copy of my book so you have a disc problem. What's the muscle that I always talk about in these episodes in the low back that will cause problems if we don't rehabilitate it? If you answer that question correctly, I'll send you So You Have a Disc Problem book. You're going to love it. Anyway, we got this muscle because see, now you're thinking, oh, he's going to accidentally spill it and say it. No, I'm not. You got to know it because this muscle is so important and it's overlooked by everybody. And this is the true mechanism of injury. What is really causing a disc problem? So a lot of people think disc problems occur because they bent down and picked up the pickles in the refrigerator and they straightened up and they went, "Oh, I can't move." No, that's not what happened. And or it's some mundane activity and suddenly they can't move. They can't get off the floor. It's sharp. It's just debilitating pain. It started happening way before that. And it's because the specific muscle became weak and it's a stabilizer of the spine, low back. And if it becomes weak, not only you're going to have excess movement or irritation on the disc leading to the disc problem. See, discs just don't herniate. They just don't what we call degenerate. And if you've had any kind of MRI and you've seen that, degenerative disc disease, L4, L5S1. It just doesn't happen. Okay, there's always a mechanism, there's a reason why it happens. And nobody talks about this. Nobody ever gives the reason anymore. Why? Why did this occur? I bet you if you are suffering from low back pain right now, chronic low back pain, and you've gone the gamut, you've gone to chiropractors, they've done spinal decompression. They've done laser therapy. You've gone to physical therapists. You've gone pain management. You've done the epidurals. You've done the facet blocks. Maybe you've done even the rhizotomy where they burn the nerve, which, oh, don't even get me going on that one. You'll get me going on that one in a later episode. All right. So you've gone through all this. First of all, did anybody tell you how it occurred? No, no, I'm sure they didn't. They just said, "You got a disc problem." So you got a disc problem. But they didn't tell you, how did you get the disc problem? I'm going to come out and make a bold statement right now. And I can't even give a percentage, but I would say the overwhelming majority of disc problems could be avoided. Could be avoided with keeping that special muscle, keeping it activated, keeping it functioning, and then keeping good flexibility. But here's the thing I want you to take away from today's episode. So you have it. You have a disc problem. You can do home based therapies to take care of your own disc problem. The money that you would commit for these home based therapies, I bet is probably equal to the money that it would take you to drive to the physical therapist office or to the chiropractic office 3 times a week for 6 weeks, or the co-payment that you've got to make, or the time that you've lost work, or the time that you spend away from your family. How do you put a price on that? So yes, there is a home-based remedy that you can do. Even now, if you're in pain, you can do it. I would start off with BioWave Go, and then I would transition into ARP PRS unit, personal recovery system unit. And then I would also do BrainTap. There's a free app. What's BrainTap? BrainTap is going to help you with that fight or flight. You're not sleeping because you're in pain. You're anxious. You may even be going into depression. BrainTap is going to help you turn that brain off. So there's things that you can do at home each day to help you defeat pain. And that's what I'm talking about. The links will be below. Okay. So, hey, send me the correct answer. Yeah, that was horrible. Send me the correct answer, please, to the muscle, and I'll send you a book that will help you with your disc problem. Subscribe. You got to tell others because the only way that we're going to defeat pain. So if you really like this, please tell others. Make sure you like it, subscribe, and hey, let's keep defeating pain together. See you in the next episode.